There are parts of the North Country that are a hospital bankruptcy or failure away from a 1+ hour drive for just basic health care, an emergency room, a birthing ward, critical surgery. What keeps those small hospitals alive is a designation called critical access care. It offers federal support and funding to keep rural hospitals in business, offering services that people need. Malone's hospital is now seeking that designation. That's today's story of the day.
Support for Story of the Day is provided by CCOM Credit Union, serving the financial needs of people throughout northern New York and Vermont. In person, online at ccom.org, and on your smartphone.
Hey, I'm David Sommerstein. It's Thursday, April 27th. First up, Congress is setting up for a showdown over raising the debt ceiling, and the North Country's representatives are on both sides of the battle. Republican Congresswoman Elise Stefanik and Claudia Tenney voted for the Limit, Save, and Grow Act yesterday in the House, which scales back federal spending while raising the debt limit by $1.5 trillion, or through March of next year, whichever comes first. Tenney explained her vote in a call with constituents last night.
The student loan giveaway that Biden put out, $465 billion we can save on that. There's a ton of areas that we saw that we can cut, at least trim, so that we bring our deficit back in place. We respect the taxpayers. We respect the fact that we shouldn't be funding everything. We need to fund the things where we have true needs.
But New York Senator and Senate Majority Leader Chuck Schumer told reporters yesterday the Republicans' plan is dead on arrival for Democrats.
Bottom line, the Extreme House plan is a gut punch to upstate families, a gut punch to upstate jobs, a gut punch to our economy. It might as well be called the Default on America Act, because that's exactly what it is, DOA, dead on arrival.
Schumer also raised concerns that the Republican bill would cut billions of dollars in federal science funding. He says that would prevent STEM workers from getting training for major technology projects across upstate New York. The New York State budget is more than 4 weeks late now. One of the casualties already? Governor Kathy Hochul's ambitious plan to address New York's affordable housing crisis. Karen DeWitt explains why.
Hochul, in her State of the State message in January, said building more housing to ease the affordability crisis was a top priority.
Today I say no more delay, no more waiting for someone else to fix this problem. Housing is a human right, and ensuring enough housing is built is how we protect that right.
She unveiled a plan where localities across the state would be assigned new housing construction targets that they would have to meet, with the goal of building 800,000 new housing units over the next decade. If municipal government leaders didn't meet those targets, the state would be authorized to override local zoning laws to get the units built. Local leaders, including in politically powerful suburban regions like Long Island and Westchester, rejected any action that would usurp local authority to design their communities. State senators and assembly members representing suburban districts refused to support the plan. On Tuesday, the governor confirmed that all of the housing proposals have been removed from the budget.
I went to Long Island. I had forums in Westchester. I sat down with elected officials who were not embracing this. And I would say from the fairly early on, the legislature showed they were not interested in the cornerstone, which was the New York Compact, which was the part that was going to really make a difference. So I said, let's not waste any more time on this.
Hochul, an avid sports fan, cited former NHL hockey star Wayne Gretzky, saying she should at least get credit for trying.
I feel a little bit like Wayne Gretzky. You miss 100% of the shots you don't take. I took the shot. And Wayne Gretzky would even say you only make 1 out of 5 of those shots. That's okay. At least we're trying and we're not done.
Assembly Speaker Carl Hastie, who did not have the support of the majority of his Democratic members for Hochul's plan, was diplomatic about the governor's loss. He says there was not enough time from when the plan was introduced in the governor's budget in early February to better inform stakeholders of the plan's benefits.
Sometimes when you want to make transformative change in policy, I think there has to be like an education period. I think letting the voters of the state understand why it needs to be done.
Further complicating the issue was the insistence by progressive Democrats in the legislature that any final housing plan include more rights for tenants. Some back the good cause eviction measure, which is opposed by landlord groups. Hochul, Hasty, and Senate Leader Andrea Stewart-Cousins say they will work to come up with an affordable housing plan once the budget is finished. They hope to have a consensus before the session ends in June. In Albany, I'm Karen DeWitt.
The hospital in Malone is applying to change its federal designation to try and improve its financial picture. As Kara Chapman reports, it's seeking more funding as a small facility serving a rural area with basic services.
Leaders at Alice Hyde Medical Center want the facility reclassified as what's called a critical access hospital. That means it'll get reimbursed 101% for services it provides to patients on federal programs like Medicare. Put another way, it could mean an extra $3 to $4.5 million a year in revenue.
So we did look at this for Alice Hyde a few years ago.
That's Becca Schutz, one of Alice Hyde's vice presidents.
We had a consultant look at it just to make sure it made really good financial sense. At that point, it didn't.
Schutz says the move does make sense now. During a video press conference earlier this month, she said rural hospitals like Alice Hyde were already struggling and the COVID-19 pandemic didn't help.
I think we're in a different position, and the consultants are telling us that this is a good move for us, largely because of where we're at with our community and our aging population, but also because the pandemic had a role.
The North Country already has several critical access hospitals. Those include River Hospital in Alexandria Bay, Lewis County General Hospital in Lowville, and Elizabethtown Community Hospital in Essex County. Alice Hyde already meets some of the eligibility requirements to join that group. It's located in a rural area, the next closest hospital is at least 35 miles away, and it provides 24/7 emergency care services. But it currently has 45 more beds than it's supposed to have. The plan is to decertify those beds, which hospital officials say haven't been used in years. That'll help Alice Hyde get down to the 25-bed maximum under its new requirements. Officials say the status change isn't expected to reduce services at Alice Hyde. According to Schutz, they also don't anticipate any layoffs.
And we continue to recruit.
The University of Vermont Health Network, which Alice Hyde is part of, ended the last fiscal year with a $90 million loss, according to the online news outlet VT Digger. Alice Hyde's slice of that was $12 million. Hospital President Michelle LeBeau says seeking the federal status change is part of a larger effort to integrate healthcare services in and around Malone and address that deficit.
How do you partner with community partners, and how do you elevate primary care? How do you make sure that you bring patients the services that they need? It's one piece, but it definitely is the first brick in the foundation of getting us there.
Hospital leaders hope the change in status will take effect by the time its next fiscal year begins in October. Alice Hyde will host a public community forum on the topic at the Malone Golf Club on May 17th. Kara Chapman, North Country Public Radio.
We have more news all the time on our website, ncpr.org. Hey, you, Story of the Day listener, check it out. Can we do a check-in by voice memo? Just shout us out. Roll a voice memo on your phone with your name, where you live, and what you're doing when you listen to Story of the Day. Really simple. And do you listen by podcast or live on the radio during All Things Considered? Then just press stop on the voice memo and email that bad boy to david@ncpr.org. It's like a Story of the Day roll call. I'd love to know who's out there listening and connecting with us. Record that voice memo and send it to david@ncpr.org. Awesome. Thanks. Music today by Christopher Watts of Canton and Paul Meyer of Colton. I'm David Summerstein, North Country Public Radio.